Welcome to Psych Curious, your hub for exploring the intriguing world of psychology. We're here to question what we know, to better understand what we don't. In this vast realm of the mind, things are not always as they seem, and it's our mission to shed light on the mysteries that lie within. At Psych Curious, we delve deep into the complexities of the human psyche. We unravel the threads that make us who we are, exploring everything from the quirks that define us to the disorders that challenge us. And today, we're taking on a topic that's often misunderstood and stigmatized: trichotillomania. Remember, understanding is the first step towards acceptance and recovery. By learning more about these conditions, we can help break down barriers, dispel myths, and foster empathy and support for those who are struggling. So join us on this journey as we seek to uncover the truth behind the habits, disorders, and phenomena that shape our mental health. Stay curious with Psych Curious, where we strive to illuminate the unknown, one topic at a time. Let's dive in. Have you ever heard of a condition where people have an irresistible urge to pull out their hair? This is a reality for those suffering from trichotillomania. Trichotillomania, often simply called trich, is a mental health disorder that's much more than a mouthful to pronounce. It's characterized by an overwhelming desire to pull out hair from the scalp, eyebrows, or other areas of the body, often resulting in noticeable bald spots. It's a compulsion, and those who experience it often find it difficult to stop, despite the physical damage or emotional distress it may cause. Though it may seem uncommon, it's estimated that 1 to 2% of the population has trichotillomania, making it a fairly prevalent disorder. It's a condition that's often misunderstood, easily dismissed as a bad habit or odd quirk. But despite the oddity of this behavior, it is indeed a serious mental health disorder that can cause significant distress. So, to summarize, trichotillomania is a potent impulse control disorder. Plagued by an overwhelming urge to pull out their own hair, individuals experience a profound emotional upheaval. It's not simply about hair pulling. The condition permeates all aspects of their lives, leading to an array of social, emotional, and physical repercussions. Feelings of shame and embarrassment trigger a cycle of isolation. The physical discomfort and the constant mental preoccupation further intensify the emotional stress, hampering productivity and leisure activities. Clearly, trichotillomania isn't just about hair pulling, it's an affliction that profoundly disrupts a person's quality of life. But our understanding of trichotillomania doesn't stop, but rather interacts with other mental health conditions. Let's delve into this intricate web. This intersection of disorders, this shared territory, illustrates a complicated landscape of the human psyche and its battles. Among the most common coexisting disorders is anxiety. It is estimated that roughly half of those grappling with trichotillomania are also combating an anxiety disorder. This could materialize as a generalized anxiety disorder, where unease and terror seem to pervade every facet of existence, or it could present as a specific item or scenario triggers a severe fear reaction. Depression is another frequent bedfellow of trichotillomania. The persistent battle with hair pulling, the ensuing guilt and shame, can lead to a sense of melancholy, a loss of enthusiasm for hobbies once cherished, and feelings of despair. It's therefore not shocking that a considerable proportion of individuals with trichotillomania also suffer from depressive episodes. And we should not overlook obsessive-compulsive disorder, or OCD. OCD is recognized by intrusive, unwanted thoughts and compulsive behaviors performed to alleviate the discomfort these thoughts create. While trichotillomania and OCD are separate disorders, they have shared characteristics, and it's not rare for someone with trichotillomania to also show signs of OCD. Naturally, we've only begun to explore the potential mental health conditions that can coexist with trichotillomania. Others may include, but are not restricted to, eating disorders, self-harm, substance abuse. These disorders can add levels of complexity to an already demanding condition. It's crucial to note, though, that while these conditions often coexist, they are not inevitable companions to trichotillomania. Every individual's journey with trichotillomania is distinct, influenced by a myriad of factors including genetics, surroundings, and personal experiences. This complex network of co-occurring disorders doesn't make trichotillomania any less genuine or valid, but it does make it more complex to comprehend, and thus, we come back to our main point. The intertwining of these conditions makes understanding and treating trichotillomania a complex process. While trichotillomania can be debilitating, it's important to know that help is available and recovery is possible. The journey towards recovery begins by understanding that it is not a character flaw or a sign of weakness. It is a mental health condition that requires professional help. One of the most effective treatment options available is cognitive behavioral therapy, or CBT for short. CBT is a type of psychotherapy that helps individuals understand their hair-pulling triggers and develop healthier coping mechanisms. It's a hands-on, practical approach to problem solving. The goal of CBT is to change patterns of thinking or behavior that are causing people's difficulties, and so change the way they feel. In the case of trichotillomania, a therapist might help the person to identify situations, emotions, or thoughts that trigger their urge to pull hair. Then, the therapist and the person work together to develop strategies to manage this urge. This could involve using distraction techniques, implementing relaxation methods, or employing other behavioral strategies. Another treatment option is medication. Although there isn't a specific drug for trichotillomania, some medications used to treat other mental health conditions, such as selective serotonin reuptake inhibitors, or SSRIs, can help reduce the symptoms. It's important to remember that medication should be considered as part of an overall treatment plan, not as a standalone solution. Support groups also play a significant role in the recovery process. Connecting with others who are facing the same challenges can provide a sense of community and understanding that is invaluable. Sharing experiences and coping strategies can help individuals feel less isolated and more empowered to manage their condition. Lastly, it's crucial to mention that patience is key. Recovery doesn't happen overnight. Each person's journey is unique, and it's important to celebrate small victories along the way. Trichotillomania may be a lifelong battle for some, but with the right tools and support, individuals can regain control over their lives. This is not just a promise, but a testament to the resilience and strength of those who face this condition every day. Quick recap of the key points about trichotillomania. A complex disorder causing individuals to pull out their own hair, leading to distress and impairment in their daily lives. This condition often coexists with other mental health disorders like anxiety and depression. But there's hope, as cognitive behavioral therapy has shown promising results in treating trichotillomania. Remember, understanding is the first step towards acceptance and recovery. Let's spread awareness about trichotillomania and support those who are battling this disorder. Thank you for taking the time to watch our deep dive into trichotillomania. We've covered a lot of ground, and it's our hope that you now have a better understanding of this complex disorder. If you found this video informative, please consider sharing it with others. The first step towards helping someone with trichotillomania is understanding the disorder itself. So let's continue the conversation and bring this issue to light. Every piece of knowledge can help change a life, and remember to stay curious.